Action.
Okay. So this is a dissection of the lower extremity. We'll start in the front here, up in the pelvis. This first muscle right here is called iliopsoas. Right, here's the psoas branch, here's the iliacus branch, iliopsoas. Kind of continuing down in the front. Right here, this little muscle is called the TFL, tensor fascia latae. You can see it goes from the ASIS here right to this band of tissue on the outside of the leg called the iliotibial band. This band actually stabilizes our knee so that it doesn't buckle side to side. That's how important it is. So every time you walk and you contract this muscle, it's tensing this band, right? So this I want you to know is the iliotibial band. I could ask you that also. The ITB would be okay also. TFL, ITB. I'm okay with that. Okay. So that was again iliopsoas. Here's the TFL and then the ITB. Let's look in the back of the hip, and this is the gluteus maximus muscle. Okay, big muscle here. Right next to it, a little bit more lateral, this is the gluteus medius. Underneath the gluteus maximus, if we take this off, are what we call the 6 lateral rotators. They're deep muscles. The one I'm going to have you guys know for my practical is the one right above the sciatic nerve. So find the sciatic nerve, big, thick nerve. Right above it, that muscle is the piriformis. Okay, the piriformis muscle. And we'll leave it at that. Okay. Let's do the inside of the thigh. So again, we're looking on the inside of the thigh. Again, you can see the pubic bone, which is medial. You can see the medial malleolus, which is medial, the big toe. You got to use those landmarks because it can get confusing. On the inside of the thigh, this big one right here, long strap-like muscle, this is gracilis. Right behind it, adductor magnus. Right in front of it, adductor longus. All right, so there's 3 adductor muscles I want you to know. Gracilis, adductor magnus, adductor longus. Okay? That's the inside of your thigh. Now we're going to look at the front of our thigh. I already did the TFL. Again, how do you know you're looking at the front of the thigh? Look for your kneecap. Look for that patella bone right there. Okay, this first strap-like muscle that goes around like this is the sartorius. This is the one that I told you we call the Taylor's muscle because it allows you to cross your ankle over your knee. And without that muscle, we wouldn't be able to do that. So this is the sartorius or the Taylor's muscle. All right, if we take that out for a moment, take that out, we're now looking at the quadricep group. This big prominent muscle in the front, rectus femoris, to the outside, vastus lateralis, to the inside, vastus medialis. Okay, underneath the rectus femoris right here, if we take that out, this is the vastus intermedius. And all of these muscles, the quadricep group, is responsible for like extending your leg if you want to kick somebody, like or kick a soccer ball type of thing, extending the knee. And so they all do that. In the back, we have the hamstrings. So again, we got to find the back. How do you know how to have the back? Look for your Achilles tendon, maybe. Look for again the gluteus muscle, so we know we're looking at the back. The hamstrings are 3 muscles. Very easy, guys. On the lateral side, and going to the fibula towards the iliotibial band right here. This is the biceps femoris. On the medial side are your 2 semis. The most superficial one is the semitendinosus. And again, if you zoom in, you can actually see there's a long tendon component to that. That's the semitendinosus. Underneath it, more broad, is the semimembranosus. Okay, so you can think of them together. The 2 semis are together. Okay, so those are your hamstrings. The hamstrings do the opposite of the quads. They flex the leg. They actually bend the leg. You'll bend the knee. Okay, so that's it for the front of the thigh, the inside of the thigh, the back of the thigh. All right, the last things we have to do is the front of the leg. Okay, in the front of the leg, I'm sorry, I'm going to just lean in front of you for a minute. Locate the tibia here, just next to the tibia, tibialis anterior. Next to that is the extensor digitorum longus. You can see the tendon going right to the toes. Okay? In between these 2 muscles, we don't see it. The belly of the extensor hallucis longus is hidden, but we do see the tendon coming down right here. Right, that's the tendon of the extensor hallucis longus. Like I said, if you extend your big toe, if you're wearing sandals, that type of thing, you can see that tendon sticking up. It pops up. I know you've seen it before. All right, so those are the three muscles there. On the lateral aspect, going the wrong way. On the lateral aspect, two muscles. I call them the two peroneus brothers. Right, this superficial one with the long tendon right here, peroneus longus, and then the deeper one right there, peroneus brevis. Right, the longest sits on the brevis. Here's the longest, here's the brevis. Okay? And then finally, we're going to finish up. Big muscle back here, forming the Achilles tendon, the gastrocnemius. Right? And then underneath that, we can see part of it here, the soleus, like that, and a little bit right there. But the best way to see it is if you take it off, and again, it looks like a fillet of sole, a fish swimming in the water, soleus. Okay? I think that was most of it. But again, my disclaimer, if I did forget anything, you should know it anyway.